Hey friends, my name is Sydney Pip and I am a pediatric radiographer, and I figured I would take you to work with me today. Let's get dressed so that we can go. When you work in a hospital, you'll be in a cold environment. This is because germs spread less quickly whenever they're cold, so the risk of infection decreases. I am not a person who handles being cold very well, so I wear a full base layer before even putting on my scrubs, and then I have a jacket that goes over top of it that I very rarely take off. So I don't get to choose the color of tops that I wear. The scrubs have to be ordered through the hospital's site, and it has to be a certain color so that all of our department is the same, or else I wouldn't choose the color purple. My scrub pants are from Figs, and I get a little bit of the hype, but not all of it. I would give it an overall 7 out of 10. I'm still looking for like the perfect pair that check all the boxes. These do not. So if you want a full review, just let me know, and I will actually my husband has some, so we can both review them for you, and that would be fun. So I'm going to get everything ready and hop in the car now. One of the great things about my job is that I only actually need my uniform, my name badge, and my markers. I could leave everything else at home and I could do my job efficiently with just those things.
Good afternoon. Please say or spell your first and last name.
Sydney Pip.
Okay, I'm logging you in as Sydney Pip.
When a provider puts in an order for an x-ray, you first go to your workstation and you pull up what the exam is. Once you have the patient information and exam pulled up, you go into the room so that you can set up the room for the exam.
He's not on oxygen, right? Cool.
Recently, we have seen an increased need for patients who require supplemental oxygen. If this patient was on oxygen, then I would need to speak with their nurse about either making it a portable exam or seeing if they can come off their oxygen for the duration of my exam. Once the exam is complete, we send those images over to our PACS system, and then we close the exam on our hospital chart. We document a full history about the patient as far as what's hurting, what they did, how long it's been hurting, if they've had a cough, how long they've had a cough, and if it's getting worse or better, history of asthma, that sort of thing. All of those notes go straight to the radiologist because they are reading the image. They're not actually seeing the patient. In my hospital, every 3 months we do our CPR course, which involves chest compressions and rescue breaths for both adults and pediatric patients. For the infant mannequin, technically you're supposed to be using 2 fingers to do the chest compressions, but the mannequin doesn't register that you're giving a compression unless their sternum is on their spine, so it takes quite a bit of effort. In between patients, we need to restock supplies and try to get a bite to eat here and there. And if anybody happens to see this that I work with, I am not eating in the tech area. This is a figment of your imagination. All of you Stanley Cup lovers can go ahead and keep your Stanleys. I will stick with my Hydrate water bottle. You can connect it to an app and it tracks how much you drink each day. You can compete with your friends, and it also lights up to remind you to drink more and to say like, hey, good job for taking a drink. We use our portable machine quite often. It's literally taking the x-ray to the patient. We can do these for extremity exams or small babies with their chest or bellies. But we are limited to what we can use it for, and the quality of the images are going to be better back in our department. We are no longer required to wear masks in our hospital, but for all the viruses that have been going around, specifically with the children that we've been seeing, I feel more comfortable wearing a mask for our respiratory patients. Even though my primary job is x-ray, sometimes I am tasked with doing EKGs, either for our urgent care department or for outpatients. EKGs are super simple to do. Really, you just stick these stickers onto certain parts of the child's body and then connect the attachments to those stickers and then wait for it to record their heartbeat. Then it gets sent over to cardiology to read. It's nice when you're able to take your time setting up a room, but sometimes you got to pick up the pace to keep up with your patient load. And this is one of those times. I'm changing over from just doing a 2-view abdomen to do a chest x-ray. So you first wipe down the room, and then you set up your tube to align with your bucky as you've seen before, and you get your light field all set up as well. These are the markers that I was talking about. You have an R and an L to represent the right and left, and then your initials underneath to show who took the image. All you have to do to get it to stick to the board is use a little piece of tape. Some people think that they're magnets, and they are not. There's typically some downtime, so I bring my iPad and some other things to do while I have time in between patients. Here I'm setting up for what I believe is to be a clavicle based on my distance from the tube to the image receptor, and I'm making a small light field. And my image receptor is dead, so we're going to go ahead and switch out that battery. I have to switch out the battery multiple times a day, so it's really important to keep an eye on how much battery life you have left so that you can complete an exam. So here's a list of exams that we did this day. KUB, T-spine, chest, forearm, chest, C-spine, chest, chest, clavicle, hand, mandible, hand, knee, ankle, chest, chest, 2-view belly, chest, hand, finger, wrist, hand, ankle, 2-view belly, chest, knee, bone age, ankle, KUB, and that's it.
Vocera.
Log out.
Okay, I'm logging you out.
That is the end of my work day. I hope that you had fun coming to work with me, and I will see you guys next time. Stay safe and have a great day.